We are involved in a lot of research. And one of the areas of research we've been involved in now for about 4 or 5 years is the idea of exercise, rehabilitation, and now also prehabilitation. Now I'll tell you about those, because what we're actually saying is if you can get patients before they are operated on to actually do the exercise, or when they are operated on to use some of the exercise kits that we have on the intensive care, we can reduce the length of stay.
So at the moment we do a range of activities with the patients, starting from when they're in bed. We might use a bed bike with them, and then we progress as patients start to wake up and improve with their strength. We would sit them up on the edge of the bed, get them into a chair, doing some stepping and walking. And we might take them off to a gym, a therapy gym somewhere else in the trust. So at the moment it's really tricky with the bed spaces, the size they are. So we've got lots of equipment, stand aids, hoists, those sorts of things, even the bed bike. So it's really tricky getting into the bed spaces because they're so small. It's really hard for the patients to engage with their rehabilitation because there's so many distractions everywhere. Sometimes we've had to take patients into a corridor outside ITU to do their physio because there's so many distractions. So not having any dedicated space has a really big impact on the patients. Having a dedicated rehab space to take patients to means those distractions are all gone away. Patients have said to us before that rehabilitation is about recovery and about improving and going home, whereas every other treatment that a patient has on intensive care is about survival. So it's really important for them to see themselves moving forward. We'll be able to take their families into the rehab space as well, and everybody starts to see the progress they're making rather than just seeing, you know, they were really poorly and now they're not really poorly. They can actually start to see the progress that they're going to be making to be going home.